guys and gals, and welcome. To those of you who just tuned in after the break, we've already mentioned that our feature for this week's psychological disorder is generalized anxiety disorder, also known as GAD. And boy, do we have a show for you today.
Yes, that's right, Sam. And I hate to break it to you, but everyone, and I mean everyone, experiences stress in his or her life. But how can you tell if what you're experiencing is just normal stress or if it's generalized anxiety disorder? Well, 4 million adult Americans suffer from GAD during the course of a year. It most often begins in childhood or adolescence, but it can also begin in adulthood. It is more common in women than in men.
Interesting, Brad. So, what is GAD? Well, GAD is characterized by global, persistent, chronic, and excessive exaggerated anxiety and a constant state of worrying, fearing, and dreading of everyday life events with no obvious reasons. Unlike normal worrying, with GAD, worrying becomes uncontrollable. People with symptoms of GAD tend to always expect disaster and can't stop worrying about things like health, money, family, work, or school. So eventually what happens is that anxiety dominates them and then boom, the person's functioning and interacts with their daily life. Normally, anxiety quickly dissipates when a threatening situation is resolved. In GAD, when you're finished worrying about something, you worry about something else, and then it's just like, That's why it's also called free-floating anxiety. The more likely you worry about things, the more likely you'll probably get GAD. So don't worry and just take a pill and chill.
Yes, anxiety can affect a person physically and mentally. Symptoms of GAD can include excessive ongoing worrying and tension. You can get restlessness or a feeling of being edgy, irritability, muscle tension, difficulty concentrating, trouble falling asleep or staying asleep, yet easily fatigued. People with GAD often have other anxiety disorders such as panic disorder, OCD, or phobias. Sam, how does one get GAD?
At this time, there are a number of factors, including genetics, brain chemistry, and environmental stresses, which appear to contribute to GAD's development.
How is GAD diagnosed? Well, according to the Diagnostic and Statistical Manual 4, the following criteria must be met for a person to be diagnosed with generalized anxiety disorder. Excessive anxiety and worry occurring more days than not for at least 6 months. The person finds it difficult to control the worry. The anxiety and worry are associated with 3 or more of the following 6 symptoms that were mentioned earlier. Here's a message we just received from a local woman. She describes her symptoms by saying, "It was just like I was petrified with fear. My heart was beating so hard and fast, it would jump out and hit my hand. I can't be still when I'm like this. I am restless and I pace up and down. Thank goodness there are treatments for GAD."
Yes, that's right. Treatments for GAD includes a combination of medication and cognitive behavioral therapy. The medications most often to treat GAD are made up of benzodiazepines and antidepressants. They work by decreasing the physical symptoms of GAD, such as muscle tension and restlessness. Common benzodiazepines include Librium, Valium, and Ativan. Antidepressants such as Paxil, Prozac, and Zoloft are also being used to treat GAD. These antidepressants are more appropriate for long-term treatment. There's also cognitive behavioral therapy. This type of therapy helps by looking at worries more realistically.
What is the outlook for people with GAD? Many people with GAD cannot be cured and symptoms can return from time to time. GAD cannot be prevented, but you can control or lessen the symptoms by stopping or reducing your consumption of products that contain caffeine. Asking your doctor or pharmacist before taking any over-the-counter medicines or herbal remedies because it may contain chemicals that can increase anxiety symptoms. Exercising daily and eating a healthy, balanced diet. Seek counseling and support after a traumatic or disturbing experience. Practice stress management techniques like yoga or meditation.
Well, that's all the time we have for today, folks. Thank you for tuning in. Until next time, have a great and wonderful day.